Welcome to Implementing School-Based Diversion for Youth with Behavioral Health Needs, the Responder Model. I'm Jackie Green from the National Center for Mental Health and Juvenile Justice. We want to cover a couple of housekeeping notes with you before we get started on the content of our webinar today. We want you to know that we are recording this webinar and we will be posting it both to the National Center for Mental Health and Juvenile Justice website and the School Justice Partnership National Resource Center. We are going to be doing a question and answer session after all three of our presenters have a chance to talk through presentations today. If you have questions along the way, please feel free to type them into your chat box at the bottom right of your screen. You can select chat with all panelists and submit your questions. We'll collect all those questions along the way and then get to as many of them as we can during the question and answer session at the end. If you have any technology or logistical challenges during the presentation, please feel free also to write in the chat box and we'll try to help you along the way so you can hear and see all of the webinar. This webinar is being brought to you through the School Justice Partnership National Resource Center, supported by the Office of Juvenile Justice and Delinquency Prevention and led by the National Council of Juvenile and Family Court Judges, along with 4 core partner agencies. Here, the National Center for Mental Health and Juvenile Justice is one of those partners, along with the International Association of Chiefs of Police, the National Association of State Boards of Education, and the National Child Traumatic Stress Network. I started working on school-based diversion here at the National Center for Mental Health and Juvenile Justice because we saw, as probably many of you have seen, that with the advent of zero-tolerance policies in our schools and an increased use of law enforcement in our schools, the school-to-pipeline has really become a pressing issue in many of our communities. We've seen that data shows that kids who have behavioral health issues are disproportionately represented in the population of kids who are the subject of exclusionary school discipline policies and who are arrested in school setting. In addition, the National Center for Mental Health and Juvenile Justice worked with 8 states in the Health Juvenile Justice Action Network, that's part of the Models for Change initiative supported by the MacArthur Foundation, between 2007 and 2011. And a big focus of that work was building diversion models at all the entry points for kids who come in contact with the juvenile justice system and who have behavioral health needs. And through that work, 2 really promising school diversion initiatives were developed, one in Connecticut and one in Ohio, the Responder Model, and you're going to hear about those initiatives today. Several core components of the Responder Model among all the key partners is critical: cross-systems training, the availability of a person who we call a responder, but you'll hear that that person is different and may have a different label depending on where the initiative is being implemented, a person other than law enforcement who can provide timely assistance to the school and to the young person and their family, and then putting structures in place that really institutionalize these processes. Cooperative agreements with service providers and protocols and policies that replace zero-tolerance policies at the school level. Hear about the Connecticut School-Based Diversion Initiative today, how it works, and the outcomes that they've seen, and also about the Responder program in Summit County, Ohio. Again, an overview of how that program works and outcomes that have been achieved. This first in what will be a 4-part webinar series on the Responder Model. We're going to get an overview of what the models look like and the outcomes that can be achieved with them. And in February, we'll start with the second part of the webinar series focused on building the right cross-systems team to support your diversion. We'll then move to focus on how you identify and get services for kids with behavioral health needs. And finally, we'll provide you some concrete tools, sample OAs, policies and procedures, training curriculums that are helpful to institutionalize any responder initiative you might develop in your own locality. Before we get started with our presenters today, I'm going to ask you to take a little poll for us. This is going to function really as a pretest for us, and when the webinar finishes, you will be to answer similar questions at the end. So if you don't mind, there are 5 polling questions that should have popped up on your screen. If you could just take a quick minute to respond to those questions to give us a sense of how much you might already know about responder models and what you might think about them. We'll pause for just a minute while you have a chance to answer those questions. We'll take a quick look at the results, and then we'll get to our substance. Thanks. Everybody, we're going to give you about another 30 seconds, and then we'll close the poll and move on. Thanks so much. We're going to go ahead and close the poll. 7 seconds remaining if you want to get your last answers in there. Right. Thanks, everybody. So just, it looks like many folks know too much about the responder model, so I think it'll be excellent that we have you all on the line today. And hardly anyone has a responder program going on in their school. So we have, I think, lots to learn from our presenters today. Hopefully we can teach a little bit about how effective these programs are. It looks like folks are starting from a pretty neutral place, so that's fantastic. Great. Thanks for doing that, and we will ask you, as I said again, at the end of the webinar when you log off, just to fill out a quick post survey, and it will help us really know how you've done in terms of transmitting information for you today. I'm going to introduce our first presenter today. We have Dr. Gina Bracey. Has a PhD in clinical and community psychology from the University of Illinois at Urbana-Champaign. Currently the Director of School and Community Initiatives at the Child Health and Development Institute of Connecticut. She's coordinator for the Connecticut School-Based Diversion Initiative, known as SBDI, which she's going to talk about with you today. And she's the project director for the Connecticut Network of Care Transformation. Gina, I think we're all set to hear about SBDI.
Great, Jackie. Good afternoon, and thank you to the School Justice Partnership for the opportunity to be here with you today to share our work on the Connecticut School-Based Diversion Initiative, or SBDI. So I'm going to start with a very brief overview on the development of the model and discuss the goals and core components, and I will end with some of our outcomes and recent enhancements that we've made to the model. So in terms of context for this work, we know that both nationally and in Connecticut, the overall number of juvenile arrests have been declining. However, the proportion of those arrests coming from schools and school-related incidents continues to be high. So in fact, in Connecticut last school year, 1 out of every 5 juvenile arrests were coming from schools. And these are primarily for minor offenses, such as repeats or minor assaults, some disorderly conduct. We national prevalence rates and the literature that there's also a significant overlap between mental health needs, juvenile justice involvement, and risk of academic failure, hence the term the school-to-prison pipeline. So ultimately, 20% of all youth meet criteria for a mental health diagnosis. In Connecticut, that translates to about 120,000 kids, and it's much higher among juvenile justice involved youth at a rate of about 65 to 70% have mental health needs. Exposure is also particularly high among youth in detention settings, with up to 90% having a history of significant events. And academic outcome data is also troubling. So students are twice as likely not to graduate from school if they are arrested there, and up to 4 times as likely to drop out if they are processed in court. We also, these rates disproportionately impact students of color and students with disabilities. So the School-Based Diversion Initiative was one model really developed to interrupt these trends by keeping kids in school, by linking them to behavioral health services when needed, and really keeping them out of courts and detention settings. The SB model was initially developed in 2008 with funds from the MacArthur Foundation as part of the Models for Change Mental Health Juvenile Justice Action Network that Jackie mentioned, and facilitated by the National Center for Mental Health and Juvenile Justice. Funding was awarded to the state's judicial branch. And based on the positive results in our early years, we started piloting this in 3 schools back in 2009, 4 agencies then entered into a unique blended funding partnership to support and oversee SBDI. So these included the Court Support Services Division of the Judicial Branch, the Department of Children and Families, the State Department of Education, and the Department of Mental Health and Addiction Services. The Child Health Development Institute, or CHDI, which is an independent nonprofit for children's health and mental health in Connecticut and where I work. We serve as the coordinating center for this initiative statewide. Here in 2015, the scope and funding structure of SBDI was further expanded by an additional $1 million under Governor Malloy's biennium budget as part of the Second Chance Society initiative, which we are very excited about. And I'll tell you a little bit more about that expansion towards the end. So to talk about the goals of the School-Based Diversion Initiative, again, or SBDI, the goal is really to reduce exclusionary discipline in schools, and this is in the form of suspensions, expulsions, and arrests. Secondly, we want to build capacity among schools to recognize and manage behavioral health challenges in the school, and to link youth who are at risk of arrest to appropriate school and community-based services and support. So our goal is unique from some other types of diversion models in that it specifically focuses on behavioral health and addressing school-related behavior incidents through connection to services and support. It's delivered as a school-level initiative that works with school and district-level staff and administration, together with community-based providers and local experts. So our role in the coordinating center is not to serve students directly, but to provide technical assistance, training, and support to the schools. To participate in SBDI, schools are selected according to 3 factors. These include need, interest, and capacity. So this is measured by the number of court referrals and arrests that are coming from each individual school, the depth of utilization of other types of services for behavioral health and mental health in the community, and also looking at interest. So that's the second factor. Are the administration, the staff at the school interested or invested in reducing arrests? And are they looking for better ways and skills and strategies to really address behavior in schools? And third, capacity. So do they have professional development time to devote to the initiative? Is there an ability to share data with them to help sort of make decisions based on that data? And also, do they have authority to change policies or practices in the schools? So those are all very key factors in making sure that this initiative would be successful. When schools are selected to participate in SBDI, there are 3 core components to our model to help implement this. And I'll talk about each of these more in detail after the slide. But the first is professional development. So this is done in the context of training as well as work group sessions. The second component is referral and service coordination. So how well are they linking up with those community services? And third is discipline policy consultation. So again, implementing additional practices and alternatives such as the graduated response model or restorative practices that I'll describe in more detail. Professional development. The goal here is really to enhance knowledge, attitudes, and skills among school staff to support arrest diversion principles and practices. And so this is done through a set of modules that includes topics such as effective classroom behavior management, distinguishing sort of so-called normal adolescent development and mental health symptoms, effectively collaborating with our community-based service providers that I'll talk about again in a moment, multicultural competence, understanding and partnering with the juvenile justice system, and promoting school climate and connectedness, to name a few of our core topics. Some of the didactic staff trainings with full staff, and others are really presented more through work group sessions that allow for technical assistance and coaching, sort of in a smaller group, data-driven quality improvement sort of format. We do have to semi-customize these modules to each school, so this is guided by a needs assessment process that we do when we first start to work with any school or district to determine what are their existing initiatives. We know many schools are on initiative overload and they already have so many other competing demands. So how does this fit in with all of that, and how do we work to really integrate and coordinate those types of things? We also work closely with local expert trainers, so rather than have everything directed at the state level, we really work to identify people in their own community to help us sustain this model over time. And again, I mentioned, when we do training modules, we really do focus on the full school. So we want administrators, school resource officers, support staff such as psychologists, guidance counselors, social workers, as well as classroom teachers, and others to really participate in this model to make it a full school approach. The second component is really around referral and service coordination. So school personnel are often asked to do more and more with less and less resources. So this aspect really helps to build the school's capacity to address students' needs by collaborating with services and supports available in the community. We're here in Connecticut to have a very robust service array. Many of them are listed here, and yours may vary. However, we too experience silos and gaps in care and in coordination of those services. So coordinators here work with communities to build and sustain those connections for schools. And again, this may vary between communities and may vary by what you see, but some of the common ones are our mobile crisis service, which I'll talk about in the next slide, EMPS, our care coordination services, so we have statewide. Families and students is very important to engage them at the local level. Enforcement, making sure that they're all on board and everyone's working together in that aspect. Juvenile probation officers, youth service bureaus, our system community collaboratives here in Connecticut. We have 26 community collaboratives that cover the entire state. They're a great source of information about referrals, resources, and needs in the community. Our juvenile boards, many of our communities have access to those, again, as a way to cases non-judicially outside of the court process. And we also have local interagency services teams, or lists, here in Connecticut, which are juvenile justice-based collaboratives. A disproportionate minority contact committee in 3 of our cities to address disparities there. So again, any attempt to really build a coalition across these services and making sure that linkages and sustained partnerships are being made with the school is very important. As I mentioned, one key component of our referral system is the mobile crisis service, EMPS. This is our responder here in Connecticut, a component of our statewide behavioral health system under the Department of Children and Families. It's available statewide to any child and family. You simply dial 211, and you are put in system directly connected to these local providers, the closest one in your area that serves your area, to come out directly to a school, to a home, or anywhere in the community where a behavioral health crisis is occurring. In Connecticut, we define behavioral health crisis by caller. So if you feel like not being able to get your child off to school in the morning, they're refusing to go to school, and it's causing, a disruption in the household, if that's a crisis, they will respond. If it's a school-based where the behavioral outburst by a student in the classroom, that counts as a crisis. It's defined caller. And many times we also encourage schools to use this as a preventive measure as well. If you're starting to see changes in a student's behavior, or you have concerns but you're not quite sure what's going on, this is definitely an appropriate service to call to come in and do that immediate stabilization, do a brief assessment or screening, and determine if further treatment treatment or linkage to ongoing care is needed. We have groups here with this service. They have great mobility. Over 90% of the time, they're going to come out to assist directly on site, and they are contracted to respond within 45 minutes or less, and the majority of the time they're there within 30 minutes. Our third component of the model, it's really to examine and revise disciplinary policies and practices where needed to support diversion efforts. So it involves developing memorandums of agreement between schools and police, and also schools and community providers such as the Mobile Crisis Responder, as well as implementation of a graduated response model or tiered behavior response system where incidents are handled by classroom teachers and administrators, and formal law enforcement involvement really is only used as a last resort when required. So a reliance on behavioral screening, assessment, and referral when needed. At any point you see a need for a type of referral, we encourage that to happen. It doesn't have to come at level 4 or step 4 in the tiered system. As the behavioral health services are not appropriate or indicated for all youth or in all circumstances, so they'll provide technical assistance and consultation on implementing this model and an expanded school mental health framework. And that addresses prevention, school climate, youth and family engagement, and also includes restorative justice practices, alternative supports for keeping kids accountable, but also building skills to address behavior challenges that might be outside the scope of traditional mental health treatment. So when we talk about restorative practices here, we really mean a continuum of more informal practices like using restorative questions and prompts to guide communication between staff and students, to more formal practices like peacemaking circles and restorative conferences. Finally, all of this work is guided by data-informed decision-making and evaluation practices. So data tracking helps identify patterns, really highlight improvements, address challenges, and plan for sustainability using arrest and court referral records, EMPS referral data from our mobile crisis service, and also looking at school discipline data, tracking suspensions and expulsions, and referrals. An external evaluator, an evaluation which is conducted by the Consultation Center at Yale University School of Medicine, and this looks across communities at things like student characteristics, community-level impacts, and has been used to expand our funding and showing great results in that way. To date, we have served 21 schools here in Connecticut across 10 of our school districts, and this has amounted to over 22,000 students who have been impacted by SBDI. We've had some pretty great results. Among our participating schools, we've seen significant reductions in school-based court referrals every year, an average rate of 45% decrease in the first year of participation, and increases in our mobile crisis referrals by 94%, and that's compared to a statewide average of 8% increase per year, so significantly more referrals coming from our SBDI schools than the general population of schools that are not participating in this initiative. We've also seen significant differences at the community level between SBDI and non-SBDI communities in terms of referral rates. So to briefly just summarize some of our results, I don't have time to give you all of our data and outcomes, but we have seen that arrests are down, re-arrests are reduced and delayed even among who are processed through the court system if they are involved with EMPS or get the appropriate mental health services. You're seeing a lower recidivism rate among those students. Extension suspensions are dropping. We've seen our mobile crisis utilization increase significantly. For reporting better awareness of community resources, which is resulting in better referrals for families, which is really what this is all about, making sure the kids are getting what they need. We're on the graduated response models, sort of clarifying staff roles and responses to behavioral health incidents, and that includes administrators and school resource officers really getting a better understanding of how all of this works together and looking for alternatives. And we see multi-level approaches, which really looks at policy systems coordination as well as these intensive in-school efforts as being really most highly effective. So we've developed a toolkit and a video also, and had ongoing support from our national partners in disseminating this model, and we'll be sharing more about that in the last webinar of this series on resources that Jackie mentioned. Do a really quick brief preview of where we're headed with the expansion. The increased capacity really gives us the opportunity to more quickly expand statewide and work with up to 24 schools per year over the next 2 years, compared to the 21 schools total we've served over the past 6 years. And we're also able to enhance key features of the model to provide more comprehensive training and support for formal restorative practices, such as circles and restorative conferences. We're able to expand supports for engagement of families, engaging law enforcement and community-based agencies like youth service bureaus and juvenile review boards. And we're significantly expanding our evaluation capacity to track indicators across systems at the school and community levels. We're also implementing a learning community model to really foster peer support of inter-district learning between schools and districts, and also sustain this professional development over time. So it was great to share this information with you and give you kind of a brief overview, and I want to thank you for your time, and also encourage you to contact me or consult some of our many resources for more information, as well as I'll be sticking around to answer some questions at the end of the webinar today. I'll turn it back to you.
Thanks, Dina. Thanks so much. So please do, if you have questions for Dina, just write them in your chat box. You can select the option to send to all panelists, and we'll get your questions here and ask them after our next two presenters are finished covering the Ohio responder model. So Lisa Harris is joining us next to describe what the responder model looks like in Summit County, Ohio. And you'll notice it's pretty different in terms of who responds to the school. Instead of using emergency mobile psychiatric services as you do in Connecticut, they have a responder function out of their Family Resource Center. So Lisa is a licensed social worker and has been the program coordinator at the Summit County Juvenile Court Family Resource Center since 2009. She became program coordinator. She was an LSW case manager and guardian ad litem for 5 years. She's also the co-chair of the Summit County Truancy Task Force Committee, and she coordinates the Summit County Juvenile Court Responder Program and Truancy Mediation Diversion Programs. Lisa.
From here in Summit County is run a little bit differently than it is elsewhere. And one of the things that I wanted to say is the responder program, and when you're looking at dealing with kids that are having truancy and behavior-related problems within the school, you can really take some of the components of all these responder programs or these school-related programs and really tweak it to meet your needs in your own community. The responder program is here in Summit County is a cooperative effort between Summit County Juvenile Court and various schools, mainly the middle schools throughout Summit County. We are not involved in all of the middle schools. Currently, we are involved in 13 of the middle schools here in Summit County. It is an effort to reduce the number of referrals to Summit County Juvenile Court. We utilize a team approach, and that's really one of the key components to our program, as well as utilizing the community resources that we are lucky enough to have here in Summit County. The responder program was developed with the National Center for Mental Health and Juvenile Justice and through the support of the MacArthur Foundation as part of the Mental Health Juvenile Justice Action Network. We have several program goals. 5 of the goals that we have here listed on the slide. Obviously, it's linkage to community resources, and that is really key. As you're looking at what some of the underlying issues are that children have within the school environment and at home, you really need to be able to link them to what is available in your community that can best meet their needs. And that's the main component and one of the main jobs of our responder case manager. The program goal, obviously, is to avoid referrals to juvenile court. What we've seen over the years as the majority of the referrals to juvenile court for truancy-related issues, many of those kids, the vast majority of those kids, obviously have underlying issues that need to be addressed. So we're looking again at kids with mental health issues, behavior issues, home issues, fate issues, and we're looking at trying to provide those services to those kids prior to a formal referral being made to juvenile court. We are looking at addressing the mental health concerns and behavior concerns that are present, and we're exploring what some of those underlying issues are as we're addressing truancy concerns. And we work with our service providers and team to develop a plan that effectively addresses those concerns. So we're here in Summit County Juvenile Court is an experienced case manager through the Family Resource Center. The responder case manager has a great deal of experience in assessment and collaboration, and they have an expert knowledge of the community resources. We're really very blessed here in Summit County with a number of resources that we have available. What can be overwhelming for a family is accessing the most appropriate resource that's available to their family. The case manager encompasses several things. They assemble a team, and I'll go over who that team consists of in a later slide. They complete an assessment, social history assessment on the family and the youth. They develop a service plan that's geared towards the needs of the family and the youth. They provide support and the linkage to the community resources. And they maintain regular contact with family and with the service providers. And that is really key. This is, as you can see, this is really a simple case management model when you're looking at assessment of need, development of a service plan, connection to community resources, and follow-up and collaboration. So it's a typical case management model that we use for the role of the case manager through the responder program. I'm going to detail some of the program requirements and really how our program is run. Schools have been identified as a responder school have a designated point person or persons that make the referrals directly to the responder program case manager. The school personnel that's responsible point people are those that have direct contact with the youth and have experience and knowledge regarding what would make an appropriate referral to our program. Prior to making this referral, though, the school personnel have made initial contact with the family so that the family is aware that a referral to the program is being initiated. And we find this being very critical, that the family needs to be aware that the school is making this initial contact with the juvenile court program. Prior to that contact, most families have not had any contact with the juvenile court. So we find that it's really helpful that the school makes that initial contact with the family and begins a discussion regarding some of the issues that they are concerned with within the school environment. Approval of that referral, the case manager then makes contact with the family. We go into a little bit more detail regarding explanation of the program and the program goals, and we then schedule an initial meeting with the family. And that initial meeting, most of the time, takes place within the school environment. We find that very important as well because we want to keep this and the family to be aware that this is a school-related issue. This has to do with truancy, behavior problems within the school environment, and the school personnel are key components of the team. The attendees include, but are not limited to, parent, the guardian, the youth. The youth is part of this planning process. Personnel, and this can include, but again, not limited to, teachers, education intervention specialists, guidance counselors, anybody within that school environment that has direct contact with the youth and knows a lot of information regarding that youth. A therapist, if one is available, is also included in the meeting, and really anybody that the family wants to bring along that they feel was crucial in detailing some of the information as well as being a support to that family. The purpose of this initial meeting is to bring all the parties together and we begin discussion on the concerns and develop a service plan. So really the initial development of the service plan happens at that first initial meeting. We want to get in there, we want to start our assessment, and we want to be able to start providing services as soon as possible to this family. We've also found that this is a really good opportunity to initiate some communication between the school, the parent, and the youth. We have found that in the past that there has been a breakdown with communication between the school personnel, parent, and youth because of the ongoing issues that have been going on with the family. And sometimes we found that the parent actually stops communicating with the school. They feel that they are to blame for what is for the issues that's going on within the school environment, and no parent wants to be put in that place where they feel like they're to blame. So we really kind of look at this as a beginning to open up some of that communication and collaboration. A team approach, and we want all these parties part of that team so we can get their input. We begin at that initial meeting, a discussion on possible underlying issues, and we start looking for appropriate resources. It's very simple to say that, kids, the reason why kids don't go to school, and really isn't a reason why kids don't go to school, or they're having behavior problems or mental health issues. And though you can really kind of look at what some of those underlying issues are, you can't really begin to put a service plan in place that's going to be applicable to that youth. So we really start looking at what could be at play and looking for those appropriate resources for the family. We look and utilize a screening tool within this process to look at some possible underlying factors, and we do utilize the MACI-2 as our screening tool to help us determine most appropriate resources, what could be, happening with that youth. We like to administer that MACI after the first or second meeting with that child. Again, it's pretty early on in the process, but we have a limited time that we can work with our clients. See, the results of the MACI are discussed with the parent, and additional referral information is provided. The teacher refers these families to a variety of resources in the community. Again, it's based on the youth needs, and I want to emphasize the family needs, because as case managers, we really look at the family and the family issues as well as the child, and until you can address some family needs, you're not going to see a whole lot of progress within the youth. Common resources that we use are mental health facilities for assessment and treatment, psychiatric services, assessment and treatment for substance abuse concerns, mentoring services, tutoring services. And again, we really look at what I consider daily living and basic needs assistance. A lot of our families here in Summit County that we come in contact with have issues regarding rent, utility, food, clothes, and employment. And again, those are really basic needs. And until you can address some of those basic needs, it's very difficult to really get at what other underlying issues might be going on with the family. Case manager, again, with this case management model, maintains a regular contact with everyone that's involved. The case manager makes regular school visits, home visits, and collects and maintains information as needed. The case managers will see their clients, the families, at least 1 month. It is more often than not 2 to 3 times within that month that they are making contact with that youth and making home visits. So it's pretty intense, but it is only for a short period of time, for a 6-month period of time. There are certain signs that indicate that youth might be having difficulty, which might indicate a referral to the responder program. And this information we share on a pretty regular basis with our school providers. There are just some things that we want the schools to kind of keep an eye on that would indicate a possible mental health issue that would make an appropriate referral to our program. There's a couple slides on this. I'm not going to read everything to you. It's pretty self-explanatory. This is not an exhaustive list by any stretch of the imagination, and we are always available to talk to school personnel if they're concerned about a youth, if they need additional resources, if they're looking to make a responder referral. And one thing I also wanted to add as well is also talk to school personnel about looking for changes in the student's behavior. I mean, some of these issues may not necessarily indicated, but if you're looking at change from year to year with a youth's behavior, or from 1 month to the next, there's something that's really going on, and that we want school people to pay attention to that, because that could indicate a referral for us for services for this family. In terms of eligibility for our programming, any youth that attends a school within Summit County that's been assigned a responder case manager is eligible for our services under the responder model. Family Resource Center provides case management to a wide variety of people in the community, not just within the school. Youth need to meet program criteria that includes concerns regarding possible mental health issues, behavior issues, and or attendance concerns. If the family is not cooperative with this model, we always let school personnel know that they absolutely can make an official referral to Summit County Juvenile Court regarding truancy or failure to send. So we always encourage that. If they feel that the services are not working, if they feel that a youth is being uncooperative, if we can't make progress, we always give that as an option that they can make a referral to juvenile court if they feel that that's warranted. Although we do really try to provide these services before that option is carried through. If there is a referral made to juvenile court, then the family is required to appear in front of the magistrate, and at that point, various court orders are issued. In terms of making a referral to the program, this form, our responder referral form, can be found on the Juvenile Court County website, and the school personnel are given information on how to fill this out. It is very self-explanatory. It is very easy. We do look for the number of absences. We look for the number of in-school suspensions or out-of-school suspensions. We want to know what other interventions the school has utilized prior to making the referral to the court. But again, the school personnel are responsible for identifying the youth. They're responsible for making this referral, and that referral form goes directly to the manager that is assigned to that particular school. There are several ways that we feel this program can benefit you. It is additional support at school and at home, and it is an additional support that the school can utilize. It's another option for them. The responder program is definitely not the answer to all of school-related, truancy-related mental health issues at school, but it is another option that it is available for the schools to be able to use. It is an option instead of filing a referral with the court. Again, we want to look at services, and we want to divert as many kids as possible away from the juvenile court process. We're looking at improving attendance. We're looking at decreasing negative behaviors, and very positive outcome has been families receiving additional supports and services. Contact information, if you have any questions after the webinar, if you'd like to contact me directly, please feel free to do so. I think we're on to you then.
Yeah, this is Jackie. I'm just going to pop in and do a quick intro for Jeff. So Dr. Jeff Kretschmer is a research assistant professor at Jack Joseph and Morton Mandel School of Applied Social Sciences at Case Western Reserve University. He's also a senior research associate at the Begun Center for Violence Prevention Research and Education. Dr. Kretschmer serves as the principal investigator on a number of local, state, and federal grants in the areas of childhood mental health, juvenile justice, exposure to violence, and trauma. And Jeff had the opportunity to do an evaluation of the responder program in Summit County. And Jeff, we are running a little short on time, so I'm just going to ask if you could hit the highlights so we have a little bit of time left for some questions at the end. That would be great. Thanks.
Sure, I'll hit the highlights. First thing I wanted to say is that the evaluation that you're going to hear about is fairly descriptive, as we were brought onto the program and the data were already gathered. So we were limited in what we could examine, but I think we were able to get a much better idea and communicate that to the court about who was involved in responder, where we were there, and a little bit of outcome data, especially as it results to juvenile justice involvement. You can see on the slides the demographics of the kids who were involved, and this is for 2 school years. We had between 60 and 70 per school year, male, and more than half of the sample were white. Average 13.5, so between 7th and 8th grade or so. You can reasons for referral. You can pick many reasons for referral, but the most common ones were school attendance issues, behavior issues, and mental health concerns. 1% of the kids were referred to responder for mental health concerns. But the results of the assessment half of those kids triggered at least one subscale on the MAISY. So you see what they triggered there. Angry, irritable, somatic complaints were the most popular. If you look at where the kids were referred, most of the kids, so about 90% of them, were referred to some sort of mental or behavioral health treatment. So going a few slides, but 9% were referred into the program for mental health issues, and 56% of them triggering on the MAISY, and about 90% of them being referred into mental health or mental health programs. So you can see that even though they weren't directly referred for mental health, a lot of them weren't directly referred for mental health concerns, the underlying issues of those behavioral problems and school attendance issues, the absenteeism and the truancy, a lot of those were mental or behavioral health issues. The determination of whether kids complete this program successfully or not was quite subjective, as it was left up to the worker to decide. The criteria for which youth were successful or not varied on why they were there. So it could be they were referred successfully into a treatment program or some community program. Did they observe improvements in the areas that kids needed to improve in? When the data, 83% of the kids were identified as successful completers. In the goals of the project, it's really that early identification and early diversion out of the juvenile justice system. So the goal is these kids as early as possible and get them away from juvenile justice if possible. But there are a third of the kids who did have charges prior to their referral to the responder program. We have others who didn't and 1/3 who did, and that's important. And again, slide shows some of our outcome data that we were able to get from the court. This summarizes whether or not kids involved in responder went on to receive additional charges or charges after involvement in the program. Broke it out by 3, 6, and 12 months. And you see that in every of those time periods, you judged to be successful participants had charges, youth who were judged to be unsuccessful. But in the 12-month, you can really see the impact of the responder program. So at 12 months, 36.5% of the kids who were judged to be successful had a new charge or had a charge. Of that, almost 7% of the kids who were judged to be unsuccessful went on to a new charge through the court. So does being successful in the response program matter in terms of future juvenile justice involvement, but also to whether or not had any charges prior to their referral. So for example, when we're just looking at all the successful kids, the kids who didn't have any charges, 25% of those kids went on to receive charge in a year of the 6 kids. Of the successful kids, or no, I'm sorry, of the kids who had a charge coming into the responder program, double that. 52% of them went on to receive another charge in a year. So not only does being successful in the program matter, but it's that presence of another charge that all matters. So that just speaks to the point of if we can get them earlier, the earlier we can get them involved in programs like the responder or mental health programs, the better for their longer-term outcomes. To wrap up, while mostly descriptive, the preliminary findings have shown responder to be an effective school-based intervention for youth. One interesting thing, as I talked about, was that while a very small percentage were referred for mental health issues specifically, over flagged on the MAISY, and 90% of them were then referred onto a mental health, behavioral health agency for treatment. Successful completion has significant impact on future juvenile court charges. So I thought as quick as I can go.
And actually got a question for you. So let's just let Jeff talk for another second. Somebody was wondering if when you talked about charges, includes truancy.
Oh, I think that would be a good question, even though I should be able to answer that. I think Lisa might know that better, since she gave me the data, and this was a long time ago.
Okay.
Yeah, that includes any charge that came before the court. So it's from truancy on up.
Super. Thanks. We do have a couple of questions for Gina. Gina, if you're ready for us.
Sure.
My question has disappeared. Okay. So the first is, I understand Connecticut recently raised the age of its juvenile jurisdiction. Did this impact your SBDI practices, or was SBDI instituted after the age was raised?
The question. So Connecticut did raise the age of juvenile court jurisdiction to include 16 and 17-year-olds in our system. That was actually phased in between 2010 and 2012, with 16-year-olds entering the juvenile system in 2010 and then moving up 17-year-olds in 2012, which does correspond with SBDI implementation. And remember, we started in 2009, but it didn't really impact our goals or initial responses to the way the model is rolled out, because it really is a diverse model from the earliest sense. So we're making the decision to convert before a kid is either transferred to adult court or is the disposition is made to either of those systems. So what we know, and the reason that legislation was enacted to raise the age was really because of the outcomes that we see with kids being in the adult system versus the juvenile system, and that because the brain research that we know about saying that kids really aren't making decisions at that young of an age, that a lot of that went into making that decision to raise the age. So, the difference really is the capacity of the system to handle the number of referrals that are coming into the juvenile system and whether services are available. So that's where we see a little bit of differences, but that's been closely monitored, particularly by the Juvenile Justice Alliance of Connecticut Juvenile Justice Alliance, and we have seen that to be a significant challenge with SBDI. It also may be familiar that Governor Malloy recently proposed raising the age again to 21 for juvenile court jurisdiction. So that involves some system crossover on the behavioral health side between child and adult service systems. So that will involve a lot of close collaboration and coordination with that as we're making referrals to the behavioral health system, if that does come to fruition. So we'll keep an eye out for that, and thank you for that question. I think there are some really exciting things happening in Connecticut that will continue to take shape.
Thanks, Gina. We have one more that was specifically for you, which is how does the responder model fit with your juvenile review boards?
Another question. So in Connecticut, schools and police both can refer directly to the Juvenile Review Board. And so SBDI, we really encourage utilization of juvenile review boards as an alternative to formal court processing. So if an incident occurs and you want some sort of response, you certainly can refer directly to the Juvenile Review Board. If additional response needed beyond handling it specifically at the school level, that doesn't involve formal court processing. And it also relates to one of our state policies that probation has, where they're able to send back inappropriate referrals back to the school. So if a referral is made from the school to a court, the pro can send that back and say, well, this really isn't a good use of our resources, or it doesn't require that level of intervention. So it requires schools to think of their alternatives, either handling it again in the school or thinking about things like the Juvenile Review Board, that many of them incorporate restorative practices and alternative approaches to really address those behaviors.
Thanks so much, Gina. I did want to let folks know that we also do have Sherry Ely from the National Council of Juvenile and Family Court Judges available to answer any questions. So if you have questions about the National Resource Center and school justice partnerships, you could also write those in the chat box, and Sherry would be happy to answer them. So, and I know we only have a few more minutes. I do have a couple of questions, Lisa, I think for you on the Ohio program.
Okay.
So one is, I see that referrals come from the school. Are those simply referrals, or are they initiated due to juvenile complaints, petitions, because the juvenile has committed a delinquent act or a status offense?
Actually, referrals prior to that. So they're referrals based on student behavior, truancy, or mental health issues. So it's a referral directly to our program. It's not a referral to the juvenile court, per se.
Great. So it so happens before a referral to the court would be made. Yeah. Okay. And also, Lisa, do you have any examples of school resource officers being part of the team that meets at the school, given how well SROs sometimes know the students? This is for diversion reasons.
They are always invited. We do usually leave it up to the assistant principal, guidance counselor, whoever made that initial referral to us. We usually leave it up to them to get the team together from their perspective in terms of who has had, related contact with that youth. But we have had resource officers as part of our initial meetings and ongoing meetings for that youth. We do that to be very, very helpful because a lot of times they have a lot of direct contact with the kids. They know, the youth's behavior, and they can give us some insight, which I find has been really helpful.
Super. And I think this next question probably any of you could jump in on. It's probably a question that applies to both Connecticut and Ohio. At what point would this model no longer be a feasible option? Additionally, how are perception issues handled regarding fairness by other youth and their parents who may get in trouble for similar situations but not have an underlying mental health issue?
Well, in terms of our program, we certainly don't stick to the underlying mental health issue as the primary referral reason. So we do try to stretch that out to include other youth that might be having issues within the school environment. What we found, though, is that when we look at those underlying issues, as Jeff stated in the study that he did for us, even though they are referred for other issues, a lot of those kids do have an underlying mental health issue. But we certainly don't exclude any youth from being to our program, not strictly based on the mental health issues.
Gina, I would just add, very similar in Connecticut, and also our most crisis response service is really, they'll come out for any crisis, again. So there's no limit to the number of times you can call for any particular child or any particular situation. Again, the goal is if it's needed, they will, with the child for up to 45 days as they connect them to ongoing services and support. But many times there isn't a need for that level of ongoing care. And so they will still come out, de-escalate that crisis happening right there, and that may be the end of their involvement. So it's really, still appropriate for any type of behavior or any type of situation, unless, of course, there's an emergency medical situation or, something that does really require emergency medical response or that sort of thing. And then even then, our EMPS teams are trained to work very closely with police departments and even respond in emergency rooms to, handle that transition and handle care from that point on after that initial emergency is out of the way.
Thanks, both of you, for taking that one. So it looks like we're out of time. We do have a couple of remaining questions. You'll see in the slides that this is Jackie Green. My contact information is there, and you can also find Gina's contact information and Lisa's contact information. So please feel free to follow up with people. If you still have questions you'd like answered, we'd be happy to help you. And one of the questions was about what it is for the change, the school or the courts, and kind of how do you engage schools, which is a great bridge to our next webinar, where we're going to talk about building our collaborative team. So I hope you will all keep an eye out for the next installment of this webinar series coming to you in February, and join us again for more details on how to pull in all the collaborative partners who you'll need to build a strong diversion initiative for kids with behavioral health needs. We would just remind you that you're going to get some post-survey questions that pop up once you log off of the webinar, and we'd beg you to fill out those questions. They're short, and they won't take a long time. It will give us a sense of how much we were able to teach during this webinar today. Thanks to all our presenters. You guys were fantastic, and thanks to everybody who joined us. Bye-bye.